Often I've been asked the question, can iridology detect diabetes? Now that's a very, very good question. And I'll tell you why. In most parts of the world, diabetes is increasing so badly. In some countries, it is doubling every 4 years. Doubling every 4 years. That's diabetes type 2 and often type 1 as well. So imagine that. Imagine the impact on the economy. Diabetes sufferers doubling every 4 years. I can tell you some countries will go bankrupt because they won't be able to cope with the influx of patients suffering from diabetes. So, question is asked, can iridology detect diabetes? What it does, it can indicate the markings in the eyes, and I'm going to show you where. This is the right eye, okay, this is the right eye. So in the right eye, we can see a marking here like this one. Can you see that? It's quite open. Now that's where the pancreas is marked on the eye, this one here. And that can indicate diabetes problems. Plus, you've got that dark color inside the iris, the actual pupil there. That dark color can indicate excess sugar in the body. And so when you have excess sugar in the body, that can attack the pancreas and forces insulin forward, can exhaust the pancreas, and hence you can get pre-diabetes and then you can full-blown diabetes. Okay? Now, so we can detect the possibility of diabetes, but we have to then get checked out from a medical professional, if you like, about how much sugar is in the body, whether it's excess or not. But we can certainly pick up if there's a problem with diabetes and with the pancreas. But we have to confirm it, and then we can recommend certain foods, certain recommendations. For example, if you're eating white rice, right? This is where we are so powerful, so much more powerful than a basic iridologist. We use this camera to take photographs of the eyes, between 6 to 8 photos of each eye. We then look at the foods that the patient or the client is eating, 3 or 4 days of food, and then we find out often that they're eating white rice, white bread, white flour pizzas, croissant with white flour, right? All the wrong foods, and those foods are causing even the white flour, white chapatis and all that, and even those white flours turn actually into sugar. And you have so much sugar coming through, not just in white sugar in your tea, but it's coming through by white rice, eating white rice, especially 1 or 2 or 3 times a day. White bread. Even the bread is 50-50, which is 50% white, 50% brown. All is white, the food being white, except for yogurt, right? Yogurt is white. Cow's milk is white, but I wouldn't touch cow's milk. And goat's milk is white. Now, but they don't cause diabetes. What causes diabetes is the white foods like white bread, 50-50 type bread, and so on and so on. Now, once we understand, we look at what the patient is taking, is eating, at that point, we can work out there's a strong possibility that there's diabetes. We will then get it tested, and then we can recommend accordingly what foods they should be eating to reverse it, and top level 5 stars platinum plus supplements to make their lungs, their liver, their pancreas recover. And hence, you should do that way. Now, what I want you to do is subscribe to this channel right now and request this book. I wrote this book during lockdown for 3 months. What your eyes can reveal about your health. It's a very good ebook. You have a lot of information in there about diabetes and other diseases. And so on to you. Subscribe now and get very, very good information on a regular basis.